Can the HIV, or rather vaccine, help to eradicate the new HIV infections? Why is there high HIV prevalence among women from age 15 to 24? What makes South Africa's anti-retroviral treatment program the biggest in the world? Is the Stop Stockhouse project a solution to the frequent shortage of essential medicines? What time is it? It's question time. Hello and welcome to the show. My name is Motsoaledi. The fight against the HIV and AIDS pandemic remains a huge challenge to South African authorities, with the Department of Education, or rather Health, receiving a big slice of the annual budget allocation dedicated to HIV and AIDS programs. Delivering his budget vote in Parliament in May, Minister of Health, Dr. Aaron Motsoaledi, introduced the test and treat strategy. Those who test HIV positive will no longer have to wait for their CD4 count to drop before they receive anti-retroviral therapy, but will be started on treatment immediately. My guest today, Anele Yawa, he is the General Secretary of the Treatment Action Campaign. Joining us from Pretoria is Dr. Jürgen Pillay. He is the Deputy Director General at the Department of Health, and Dr. Anamika Premraj, who is the Director of HIV Prevention Research Unit at the Medical Research Council, and she's joining us from our Durban studios. But before we do that, let us firstly take a look at this insert.
The dramatic reduction of mother-to-child transmission of HIV, as we welcome the marked increase in the average life expectancy of South Africans, we must be alarmed at the rate of new HIV infections, because it still remains stubbornly high.
That's Deputy President Cyril Matamela Ramaphosa. As I've said, my guest, Anele Yawa, he's the General Secretary of the Treatment Action Campaign. And joining us from our Pretoria studios is Dr. Jürgen Pillay, who's the Deputy Director General at the Department of Health, and Dr. Anamika Premraj, who's the Director of HIV Prevention Research Unit at the Medical Research Council, and she's joining us from our Durban studios. Let me welcome all of you to the studios, or to the show. Perhaps, Anel, let me just start with you. I saw something which is written at the back of your T-shirt there. Says, "We still die of TB and HIV."
Yes. As much as South Africa is having more than 3.5 million on ARV, but every week in South Africa there is an estimated number of about 5,300 and something new HIV infections, and out of that 2,000 is young girls only. We are concerned. But also a typical example in Gauteng. In Gauteng there are more than 778,000 people who were initiated on anti-retroviral treatment. But we got shocking news that about 71,000 of these people are lost on follow-ups. It is a concern to us. But also, in South Africa, there are more than 7 million people who are living with HIV and AIDS. Only half of them who are on ARVs, and the other half is not on ARVs. We don't have adequate access to quality healthcare services. In many instances, people are failed by the system. That's why you will see many people who are living with HIV and AIDS are still dying even on this day.
Now, this year's International AIDS Day comes at a time when there's the launch of this HVTN 702 HIV vaccine study. What is your position there?
It is our wish that one day we can be able as the country and globally to fight with new infections. So we are encouraging these trials with the hope that at the end of the day, the outcomes of the trials will be 100% effective, so that people are able not to be infected by HIV and AIDS. But also,
infections, yeah.
on top of that, one of the things which makes us happy is that people who are behind this initiative are from South Africa. It means that if the outcomes are positive, South Africa would have contributed globally in the fight against HIV infections.
Dr. Pillay, as government, what are your targets in as far as this HVTN is concerned?
Well, firstly, good evening, Mpho, to you and to your guests. Well, the targets are the targets set by the trial and the scientists who are running the trial, and I'm sure that the person from the Medical Research Council will be able to respond to that. Yes. But as Anele says, we would like a vaccine that is more than 50% effective. Less than 50% effective is not good enough, as was shown in the trial that was done in Thailand. Most vaccines that we have, and we have a lot of vaccines that are largely childhood vaccines, like vaccines for measles, polio drops, etc., are 80% and upwards effective. So we would like to see that this vaccine is also as effective as those vaccines, but we will take anything above 50%. 50-60%, I think, is what the investigators are shooting for at least.
Now, trials ordinarily would mean that you need some guinea pigs here, Dr. Pillay. Who are these?
So I don't think we should call them guinea pigs, Mpho. These are subjects in a research trial, and we must remember that they give their consent and they need to be fully informed about the positives and the potential side effects of, in this instance, the vaccine. But in any clinical trial, firstly, you need to get ethical approval from an ethics committee, and secondly, you must get what's called informed consent from the participants in the survey or in the research. And this, we are very strict about that in South Africa, and I believe that we do everything possible to protect the subjects in the research trial. We must also remember that and I'm sure that my colleague from the MRC will say more about this, that we are not injecting these patients with the HIV virus. So there is no possibility of people getting HIV from the vaccine. And I must also say that as part of the trial, there is usually a comprehensive package of services provided, which will include testing, of course, to ensure that they're negative, to provide them with condoms, to do STI screening. So there's a whole range of services provided in addition to the vaccine that's administered to these subjects.
Okay, Dr. Primrose, perhaps let me just bring you in there. How is this going to happen? How is the study going to be conducted?
So you had asked how many participants we would be enrolling. So we will be enrolling about 5,400 volunteers, and I want to stress that the volunteers we enroll are the true heroes, because they are giving of their time in this effort to find a prevention method to fight this disease and this virus. This trial will be done across 15 sites in South Africa. We've started enrolling our participants in Durban and Verulam. Yesterday we enrolled our first 2 into the trial, and it will be done over the course of about 4 years.
Now, Dr. Primrose, help me understand here. You would have to take it to the most basic level. How is it going to work? When you say you're putting people on trial, it means ordinarily what I'm thinking is, okay, these people are going to be brought into whatever the center is. You inject them with this, whatever you call it, the vaccine, right? And then what should happen after that? Should they go out and be at risk of contracting HIV, and therefore you test, you see, or you are able to then see whether or not this vaccine is repelling?
So it's a process, and the process starts in the community. So before we can even start a research trial, we have to engage with the community first, engage with community leaders, and then we go out and educate the community about HIV, how to protect themselves. And once we have that engagement and that relationship, that is when we can then discuss further about the trials that we are conducting. And it really is a partnership that we have with the community. And the volunteers that we enroll in the trial, they go through a vigorous screening process, and they get a lot of education and counseling on how to protect themselves from HIV. But we know from research done previously that in spite of intensive counseling and provision of condoms, STI testing and treatment, male circumcision, in spite of all of that, we still have 1,000 new infections of HIV every single day in South Africa. And so even though we will be providing all of this to our volunteers, we are hoping that if they cannot negotiate safer sex practices, that the vaccine will provide some sort of protection in those instances when they are not using condoms, when they are at risk of getting the infection.
Now, how are you going to see that your vaccine works if people are not at risk of HIV?
Sorry, can you repeat the question?
The vaccine is supposed to prevent the infection of HIV, am I correct? So in order for you to see that indeed it works, it means if I'm negative, I must have access or must be in contact with a specimen or blood that is positive, correct?
So with our aim is to prevent HIV infections, but we also want to find a vaccine that is effective. And the only way we can find an effective vaccine and test it is in a population where that HIV is prevalent. And that is why we are doing these trials in South Africa. Okay. Because if you are a sexually active person in South Africa, and unless you are using condoms 100% of the time, you are considered at risk for HIV.
Okay, Dr. Pillay, I'm going to try and get this from you, if able. If you want me to, or rather, if you want people to stop smoking, for instance, and you get me a vaccine that says once we use this, smoking is not going to kill you or something of the sort. I'm not so sure if this example will hold, but let me try. It means that I must get the vaccine and then continue to smoke so that we can see the effectiveness of the vaccine or not. Now, in this case, I am saying, how do people get on the vaccine rollout and then not subject themselves to risky behavior in order for the scientists to realize or to see or to gauge whether their methods work?
So, Mpo, I think that we must take a step back and say that, the Thai study, a study in Thailand that was similar, that also used a vaccine, was done on about 16,000 Thai people to look at whether or not the vaccine prevents transmission in people who, if they don't practice safe sex and don't have the vaccine, are very likely to contract HIV. So what we've done and what the scientists have done is that they've taken that same vaccine and they have re-engineered it for the specific type of virus that's circulating in South Africa, so that we can be sure that the vaccine works in South Africa. So it's already been used, or a variant of the vaccine has already been used in about 16,000 Thai people in 2009, but it's been re-engineered. Now, coming to your question about, so how will we know whether or not the vaccine works in the South African context and in a context where we are also saying that people must use condoms and practice safe sex. Now, the scientists, these are very clever scientists in Port. What they have is a set of statistical methods that can clearly show the effect of the vaccine over and above the effect of condom use, consistent condom use. You see, one of the things we know about condom use is that in our population, like in many populations around the world, it's very difficult to practice safe sex consistently. And that's why we will know, on the basis of that premise, whether or not the vaccine works or not. But as Dr. Premraj says, that in our context, we have very high levels of incidence and of prevalence of HIV.
Okay.
So it's a really good place to test out whether this vaccine works or not.
We're going to take a quick break. When we return, we'll continue with the show. This is Question Time. Please don't go away.
It's more than a gift, it's capturing summer magic. Get a Galaxy S7 Edge with Tab 3 Lite bundle for $6.99 per month on My MTN Choice Flexi 200. Plus your choice of a Gear VR or an accessory kit. The Galaxy S7 Edge, now in blue coral.
Ladies and gentlemen, introducing the man who takes the party from zero to hero, from bland to grand, from average to, well, to way above average. The guy who toots the party train horn and says, "All aboard!" You are indeed a party comrade, and we salute you with a bottle of Chivas Regal 12-year-old blended Scotch whiskey, plus 2 glasses for just $279.99, exclusive to Tops at Spa.
Welcome back. You're still watching Question Time. We'll be taking your calls on 089-110-4210, 089-110-4210, Twitter handle at Question Time 24. Lucky, you are in Durban. Welcome.
Hi, Paul. How are you?
I'm well. Thanks for the call, Lucky.
Yes, let me assist you. In asking the right question to the researchers there.
Yes.
Fellow researchers, I want to know from you that how will we know that how are you going to gauge the effect of the vaccine? Are you going to say, is it because people were using a condom or behaving, or is it because of the vaccine? How are you going to know that?
Lucky, thank you very much. Dr. Premraj, let me start with you.
Okay, thank you. In this trial, half the volunteers are going to be getting the actual vaccine and half will be getting a placebo, which is sterile salt water or saline. And the way the study is designed, it is designed in such a way that at the end of the study, when they analyze the data that we collect over the course of our the participation of our volunteers, they will look at all the data across the people who received the vaccine compared to the people who received the placebo. And they will compare the two groups to see how many infections occurred in the vaccine group compared to the placebo. There's also information that we collect regarding condom use, regarding sexual behaviors, number of partners, all of this over from the time they start in the study until the end. Okay. And when they analyze the results, they will take all of this into consideration, and in that way they will find a difference. If they find a difference, they will be able to tell whether it's due to the vaccine or whether it's due to the counseling, and that's as simple as I can explain it.
Okay, Walaza, you are in Gauteng. Welcome.
Yes, how are you?
I'm well.
Fine. You know, I want to make an example to us. If you want to test the effectiveness of a raincoat, one is to wear it on the rain, isn't it?
Yes.
So I want to check with those guys there. How are we going to know that the vaccine is effective?
My point exactly,
yeah.
Walaza. Thank you very much. Dr. Pillay?
Yeah.
Yes, let me have another go, Mpo. And I think it's very simple. As Dr. Premraj says, of the total number of people who are on the trial, half will get the vaccine and half will not get the vaccine. And the hypothesis is, and what we are testing, is those that get the vaccine are significantly less likely to get HIV compared to those that don't get the vaccine. And we are saying that more than 50% of those that get the vaccine should not contract HIV compared to those that do not get the vaccine, that get the saline solution that Dr. Premraj spoke about. Noting that the way in which people will be put into these two groups will be what's called randomized, which means that you can compare the two groups. There will be no difference between the two groups in terms of males and females, age, how many times, how many partners they may have, whether they use condoms or not. So all those other things will be controlled for. The only difference in these two groups is that one will get the vaccine, one group will get the vaccine, and one won't. And what we're trying to prove is that those that get the vaccine are significantly less likely to get HIV. That's basically what we're trying to do.
Let me bring you in here. I don't know, I was called to order by Dr. Premraj there, or Dr. Pillay. I must not call people guinea pigs. They are participants. So, are you for this method of research? I know, we all are praying and wishing for the development and discovery of a cure. Are you for this method?
One, in principle, as TAC, as you have said, we would like to see one day that there is a vaccine. And also, as TAC, we are not researchers or scientists, we are activists. And in South Africa, there is a constitution. And within the constitution, there is a Bill of Rights. So we would not like to comment on how is this going to happen, because we don't want to violate the rights of those who volunteered to be part of this. But also, on our side as an organization, we have requested our research team to give us more information about this, so that at the end of the day, we are not accused of being for or against.
Without proper information or sufficient knowledge. That's a good one. John, you are in Soweto.
Yes, I'm in Soweto. Thank you very much.
Go ahead.
Paul,
yes.
How are you?
I'm well. Thanks for the call, John.
I'm good. You know the problem that I've got? You, the people of TV, you don't go to these other places like Chastworthy, Lenasia. What we see there, we see blacks. Where are these other nations so that you can see that this thing is working? Always it's blacks. That is my question. I'm so worried about. Always when you talk about HIV, it's only blacks that you can see on a TV. Where are these other nations? We don't go to Churchworthy. Thank you.
John, thank you very much. Well, I think you're raising a valid question. That is the media. Why should the face of HIV and AIDS be black while it actually affects all of us? And that's basically the challenge which has to go out to all of us in the media space and practitioners to ensure that we reflect the true state of affairs, that indeed HIV affects everybody regardless of race and age. And that was question time for today. We have run out of time. A big thank you to my guests and to you for watching the show. From me and the crew, you have yourself a wonderful time. Iva Hot.